Dr. Malone, April. That's so funny. We started this in March. It's May now. May 8th. We are ending our, I think, 8th week. I'm starting to lose count. Like everybody else in the world, like it's like, what day is it? What month is it? What time is it? Anyway, it's Friday afternoon, the end of the 8th week of this dumpster fire. We still don't have any testing that I can rely upon to trust that I could tell somebody that's high risk. You know, we got a couple of high risk people on our staff. How do I tell them, oh, come into the office, you'll be fine? How do I say that if we don't test everybody here, like they do in the White House, right? So picture this. Picture we have tests as available as the White House. So every day, sometimes twice a day, we can test everybody on the staff, and then we can find out who's got it, right? So like today, they found out that somebody's press secretary, I guess Pence's press secretary, has it. And she's married to Stephen, whatever his name is, Miller. And so they tested her yesterday and she was negative. They tested her today, she's positive. So now everybody had to stop the plane that Pence was on and get everybody off and take them back. That is the only way that we would be able to work in this environment, because otherwise I'm telling somebody with high risk, no, you're more productive when you come in the office, and trust me, I'll protect you from getting this virus. How can I say that in good conscience? And I'm sorry, I'm as vital as they are and as productive as I want them to be. I'm not willing to risk their health and well-being, right? So that I can make an extra buck. But in any event, here we are, right? I'm getting frustrated with the situation. I think everybody is. I'm frustrated with the fact that we don't have testing. We're not doing everything in our possible. Everything should be geared towards that. I did hear this week that you could go and get a test at LabQuest. We talked about that yesterday.
Yeah,
right?
Yeah, LabCorp,
whatever.
Yeah, well, Quest doesn't specifically have it, so.
Oh, okay. Well, thank you
for the antibody. Yeah.
And then, but it takes 4 days to get the results back. It's like, are you kidding me? Are you kidding me? I mean, what country are we living in? My God, we need to get our stuff together. So anyway, give us some numbers. These videos need to last 10 minutes. We figured that out.
Yeah.
Looking at some of the numbers.
Yeah. So real quick for the state numbers, I guess about a week ago we're at 1,400, and now we're at 1,650 as far as deaths. So it's slowed down there. We've only gone up about 2,000 over the course of the week. This will probably be the quickest way to show you on here if we do the state's website, which before the state dashboard. So if you look at the right hand side where it's got all those orange bars, obviously overall it's a downward trend with a couple of spikes, and that's statewide.
It's not even loaded It's not even loaded yet. Is it loading?
Okay. It should be loading. Yeah. Let's see here what happens. I'll try to refresh this.
I can see the yellow off here to the right. New cases by residents of Florida.
Yeah. So does it load now? Do you see
the numbers are up. You got the numbers up.
So let me go to
I think is the money shot. Yeah, there you go. Okay.
So this is the Escambia County numbers here getting pulled up. Let's see what happens if I can pull that up. If not, I'll just tell you. I'll share. Yeah, it doesn't look like it's loading the county numbers for me as I had anticipated. So
are we looking at the state right now? Is that what this is?
Yeah. So this is the state trends. Let me go back to. So this is the state. So, sorry about that. Okay, well, I'm going to abandon this since it's not working. But overall, what I wanted to show you initially was the orange bars on the side, where the daily cases are overall trending downward with a couple of spikes, which is good news statewide. And our county numbers are very similar to that. And so again, a week ago, countywide, we were just under 600 cases. And here we are at the end of the week, and we're at 620 cases. It slowed down dramatically as far as positive cases during the course of this week. And
what about the long-term care facility stuff?
So the long-term care facilities are grossly unchanged, and I do have that. This was released today, and it is right. Let's see here. So that was released today, and we still have the one facility with the 94 cases. It's still the highest in the state. However, the other facility we had that was the second in the state has now been replaced with other facilities, and it still has, here we go. So this is as of today, statewide. Residents and facilities are 15.
Well, those numbers have not changed very much since Sunday.
Not a lot. It's for everyone that's gone up, they've gone down somewhere else. So again, this is current cases. So this isn't cumulatives. And so I'll scroll down to the Escambia County numbers here.
Are we still like setting records here?
Well, we still have the highest number there with the Southern Oaks being at 94. So that we still remain, I guess, number one in the state there. As far as the other,
is that us too?
Yeah, that's Bayside, and that was, if you recall last week, I think that peaked in the mid 40s, and so that is no longer number two in the state. There are other facilities that have like 50 or so in the state. But if you look at our county, it starts at Arcadia Health up there with 7, and then it extends down to Specialty Health that's got 1. So if you just do some quick math, it looks like we're about 160 or so current cases in long-term care facilities in the state out of the 1,700 in the state. So again, just around that 9 or 10% of the state in just our one county. So still inordinately spaced out.
Do we know how many of those have passed away?
We don't. The long-term care facility death, I guess toll, I would say, death recording is supposed to release once a week, and it was released last week on this date. And just prior to going on video, I looked and it has not yet been updated. So no updates there. So I think the last numbers we had were in the county for long-term care facilities. 8 of the current 18 deaths were confirmed associated with the facilities. So we have 18 deaths in
when you scan this for today, do you see any other counties that are setting records like us in this horrible category?
Well, there was one at the front that kind of caught my attention. So, like, let's see here, where was it? Yeah, like here, like all of a sudden Broward's got a facility that's got 48 there, and then there was another one down, like in Charlotte County, 23. That's a big jump. I think they didn't have that last time I looked. So, but no one's above 94, like we are, in one facility. So if you just
abject neglect.
Yeah. So if you just look at this column that's right next to the date, as I scroll down, you see like some 20s and some 30s, 38. There's a 59 there, and the 59 is in Miami-Dade.
Miami-Dade County, a tad bit bigger than Escambia.
Yeah, okay. A lot more dense. So that's the basic numbers there. And then I guess I just wanted to remind people that when you have the opportunity for antibody testing, if that's something that's offered, if you think you've been exposed, that would be probably right now the most reliable thing to say, hey, I'm maybe not at as much risk as I was before, because look, I have an antibody to it. So I'm one of those people that can get back to my routine and perhaps not be a vector for anybody else.
Well, I don't know if they've convinced, I don't think the science is in on that though, right? I mean, you possibly could still carry it, right?
Yeah, you could still transfer it like on your skin, but you're not shedding it the same as someone who's infected. So that's just one measure of it, I guess, when we're expressing frustration of, oh, I can't tell if I have it or not, because a much worse situation is I have a negative antigen test, which is the test that they're swabbing people's noses for. I have a negative test at the moment they test me, but on the ride home I could contract it.
Right.
So it's only as good as the moment that they're doing the test.
Right. Okay. Anything else, Dr. Malone?
Just interesting tidbits that I guess we saw. I was going to try and withhold from showing a whole lot of studies, but one showed that there's association with people who don't fare well with this disease, who after the fact, literally during postmortem analysis, are finding clots, venous clots. So pulmonary emboli, deep venous thromboses, and the thought is that this induces a hypercoagulable state with part of that cytokine storm. And so some of these facilities are starting to initiate full systemic anticoagulation of people who are at higher risk. So instead of getting like the little prophylactic dose of whatever heparin-based product people are using or hospitals are using, you're getting the full blast version of, hey, we're just assuming you have this or you're going to get it, so we're just going to thin your blood out. So
like there's not enough problems going on with those people, right?
Exactly. So
you gotta worry about them throwing a clot.
Yeah, and so you could be recovering from the virus, and then the terminal event is the pulmonary embolism.
Well, I guess the only good part of that is you're in the hospital. So if you do throw an emboli, at least you're close to where they can do something about it.
Yeah.
Okay, so that's that. Now, from a car wreck standpoint, I mean, business is basically picking back up, which tells me that people are back on the roads, which tells me that wrecks are happening, which tells me that people are getting around, I think, more than they should, be honest with you. The concern I have, again, is people are not just driving crazy, I think, right now. They're driving really crazy. There's some drinking and driving. There's a lot of drinking and driving during the day. Drinking and driving. I had a case that came in last Saturday, 11:30 in the morning. A drunk guy runs a red light, T-bones a car, put somebody in the hospital for several days. People are just so happy to be, like, I guess, out, that they are, living it up a little more than they should. And the other thing I think they're thinking is maybe they're not going to be able to do this for a long time. Maybe there's a potential they're going to be back in the house, right? And so I better get it out of my system. So anyway, be careful driving. Try to stay off the roads at busy times. I don't like driving when it's busy. I don't think it's a good idea if you can avoid it, to do that. Heading out to the beach at certain times is probably not a good idea. Be aware when people are coming from the beach, because a lot of them were drinking. The bridge, obviously, 3 Mile Bridge, the termination point of the 3 Mile Bridge into both Gulf Breeze, but mainly into Pensacola, it gets backed up. People have wrecks there all the time. Be aware. On the waterways, be aware. Jet skis are going every which direction. Boats are going every which direction. Be careful. As for the virus, we're going to be working again next week. All the high-risk people are still at home. We have a skeleton crew on this floor and that floor. We did protocols this week with taking temperatures and wiping down surfaces, letting only really necessary people in the door. All of our meetings have been via Zoom. We had a depot today in a medical malpractice case via Zoom. I sit right over there, so I keep pointing. All the witnesses were attending by Zoom. So had hearings this week, same way. But we're here for you if you need us. Dr. Malone's available for consultation for our clients' medical issues. You can find us on the web at zarzaurlaw.com. Our phone number is 855-HIRE-JOE. We'll see you next week. Hopefully, we'll be even heading down with a sharper turn, right? That's the good news. But I hope, I really don't hope for anything other than testing. I need more testing. I need more widespread testing availability so that I can function in a normal fashion. And every other business, if it got so ingrained, like it was something you could just use, is user friendly, all the other businesses could open, right? People's houses you could run differently. Okay, everybody in the house, you're taking your test today. Everybody test negative, great. Okay, go about your day. Next morning, same thing, right? Somebody tests positive, they don't go anywhere. And then everybody they dealt with the day before and 2 days before needs to be contacted. Anyway, all right. Maybe we'll get there next week. All right. Y'all take care. Have a safe weekend. Thank you, Dr. Malone.